Hi and hello everyone, welcome to the Nursing Virus YouTube channel, and this is me Logunathan, and this video regarding the Community Health Officer examination from the state of Maharashtra, which the exam was held on the date of 16th October 2020. The completely solved questions and answers with a detailed explanation we'll see. And so far, if you're not subscribed my channel, don't forget to subscribe and click the bell icon so you will get all my video notifications related to the nursing MCQs and the job notification from all around the India. Let's go for the today's discussion with the completely solved questions and answers. Community Health Officer Maharashtra, they had 4 set of questions, set A, B, C and D. So on this video, I'm going to discuss from the set D. So the first question, the Yokesh 17 years old male has height 170 centimeter and weight 68 kg. What is the BMI of Yokesh? So I think everyone knows the BMI calculation formula, that is the weight in kg divided by height in meter square. So here they're given that height in that centimeter, so convert in that meter, and the weight directly they're given the kg, that is a 68 kg. You can write as it is, and you can simplify this area. When you are simplifying this calculation, you'll get the answer for the BMI 23.52 kg per meter square. So the correct answer is B. So the second question, so after an epidemic of measles in a village near the Kanpur, some children reported with a history of weight loss and blindness from that corneal scarring. The most likely cause of this complication is deficiency of vitamin K, vitamin D and vitamin A and vitamin C. So I think everyone knows that blindness were mainly reason of vitamin A deficiency. So the next question, the sexually transmitted disease are prevented by using intrauterine device, condom, oral pills and natural method of family planning. So always the condoms will be much helpful to prevent the sexually transmitted disease. So the next question, DMPA, depot medroxyprogesterone acetate injection should be given deep intramuscular every dash month. Options are 1 month, 2 month, 3 month and 6 month. So the correct answer is 3 months. Every 3 months the IM injection can be given. So the next question, the number of daughters a newborn girl will bear during her lifetime assuming fixed age, specific fertility and mortality rate refers to which one of the following? Gross reproductive rate, net reproductive rate and total fertility rate and general fertility rate. So the correct answer is the net reproductive rate. So the next question, so which of the following is the major cause of the poor health in Indians? Noise pollution, soil pollution, and water pollution, and the last one, air pollution. So here the correct answer, that water pollution. So the next question, the blood smear collection target for passive surveillance is dash of new OPD cases. So the percentage wise they are asking 15%, 10%, 5% and 20%. So the 10% of new OPD cases were targeted for collecting that blood smear in that passive surveillance cases. The next question, if a person is having dash skin patches with definite sensory deficit and or more than one definite thickened and tender peripheral nerves, then it is the case of multibacillary leprosy. So they are asking how many patches were indicating for the multibacillary leprosy. The more than 1, more than 2, more than 3 and more than 5. So here the correct answer. So if the person having more than 5 skin patches, the person will be considered as multibacillary leprosy. So the ninth question. So the first Indian citizen who received Nobel Prize, C.V. Raman, Har Gobind Gurna and Subramaniam Chandrasekhar and Rabindranath Tagore. So here the correct answer, the Rabindranath Tagore, the first Indian citizen who received the Nobel Prize. So the next question, who announced the discovery of Mycobacterium tuberculosis, the bacteria that cause tuberculosis? Robert Koch, Louis Pasteur, Sir Ronald Ross, and Sir Alexander Fleming. So the correct answer is Robert Koch. So the next one, the MUHS University was established on which date and which year? So the options are 3 June 1998, 3 June 1997, 3 June 1999, 3 June 1995. So here the correct answer, on the 3rd June 1998, the MUHS University was established. So the next question, look carefully for the pattern and then choose which pair of the number come next. So they're asking the pattern. The numbers, given numbers are 41, 40, 38, 35, 33, 31 and 28. So here the pattern number they're asking. So here the next pattern will use to come, that is a C, 26 and 24. So the next question, the length and width of the rectangle park is 14 meter and 7 meter respectively. Find the area of circle of maximum radius in the park. So with that radius calculation formula, if you are calculating, so the answer will come for the 154 square meter. So that is the circle of maximum radius in the particular park. So the next question, which continent has highest number of countries? The options are Asia, Europe, North America and Africa. So they are asking the maximum number of countries. So here the correct answer is D, that Africa. The Africa country is having around 54 countries within the African country. So next question, who was the first woman Lok Sabha Speaker of India? Sushma Swaraj, Meera Kumar, Smita Mahajan and Meena Kumari. So the correct option is B, Meera Kumari. So she is the first woman speaker on the Lok Sabha in India. So 16. Dash city in Maharashtra don't have bench of High Court. The Mumbai, Pune, Aurangabad and Nagpur. So that correct answer is that Pune. So the Pune city in Maharashtra don't have the bench of High Court. So the next question. So the best way to plot the geographical distribution of disease is, they're asking the statistical wise, that is a bar diagram, histogram and pie chart and spot map. So here the correct answer is spotting map or the spot map. So mainly this can be much helpful for marking the geographical distribution of disease on the map. So the next question, 18. Dash is one of the limb of Ashtanga Yoga. So they are asking about the type of Ashtanga Yoga. So the correct answer is B, Nyam. So this is one of the limb of Ashtanga Yoga. So 19. As per SRS data in the 2015 to 2017, maternal mortality rate of Maharashtra is 55, 57, 63 and 122. So the correct answer is 55. So according to the SRS data on the year of 2015 to 2017, that is the MMR rate in Maharashtra. So the next one, in COVID-19 surveillance for the non-comorbid condition, any temperature of dash or greater is considered as fever. So here if you are looking for the first three, that will be, everything will be under the normal range. So the option D, about that 100.4 degree Fahrenheit can be considered for that COVID surveillance. So the next question, 21. Dysphagia is the defect that cause difficulty in walk, vision, swallowing and speech. So here is the direct question. The option D is speech, that is the term. where the person getting difficulty, that is the term is called as dysphagia. So the next one, the constituent element of that parkritry are, so here the correct option is B, sattva, rajas and tamas. So this is the correct answer for this question. So the next one, the population of Savangan subcenter was 7,000. There were 100 births and 50 deaths. Out of this, 2 infant deaths in a year of 2015. What was the infant mortality rate of Sarvagona in that year? So here it is the direct question for making you to get confused. They given that subcenter rate. So here for calculating that IMR rate, you can go with this formula. That is the number of death of the infant under 1 year of age among the population of a given area during the year divided by the number of live birth registered among that same population of the area during the same year into 1000. So here the number of infants were born on the particular year, that is the 2 members. The total number of birth rate on that particular year, that is 100. So you can enter into that calculation and into 1000. So that if you are making the simplification, the IMMR rate will come as 20. So the correct answer is 20. On that infant mortality rate for that Savargan in that 2015 year. So the next one, which is the COVID-19 suspected case? So here they're given the list of symptoms. They're asking the suspected case. The A, acute onset of fever and cough, and B, acute onset of any or more sign or symptoms like a fever, cough, general weakness, fatigue, headache, body ache, sore throat, running nose, difficulty in breathing, loss of appetite, nausea, vomiting, diarrhea, and altered mental status. And other options like A or B, and D is none of the above. And we everyone knows on the current pandemic situation, we everyone knows the clear symptoms of COVID-19. So here A also will come and B also come. So the correct option is both A or B. So the next question. And 25. An 8 weeks pregnant lady comes to the OPD for the antenatal visit for the first time. She told the doctor that she has come from far off area and it's not possible to come for her monthly antenatal visit. So the doctor advised the minimum number of essential antenatal visits are, so options like 3, 4, 2 and 6. And according to the WHO, at least 4 routine antenatal visits should be done by the antenatal mother. So here the different months I have listed according to the WHO. So the 4 visits is must according to the WHO. So the next one, 26. An unimmunized woman in the 7th month of pregnancy reports to you in the antenatal clinic for the first time. The recommended immunization is by DT vaccine, hepatitis B vaccine, rubella vaccine, and tetanus immunoglobulin. So here, tetanus and diphtheria vaccine should be administered for every pregnant woman. So the next question, BPH is defined as the loss of dash ml of or more of blood during or within 24 hours of birth and up to 6 weeks of delivery. How much ml the blood loss they are asking for diagnosing the person with BPH? So the correct answer is 500 ml of blood or more than that. Blood if the woman were losing, the condition were considered as BPH. So the next question. Vitamin dash is needed for prevention of hemorrhage disease of the newborn is vitamin K, D, E and A. So here the correct answer is vitamin K. So that vitamin K is must for preventing the person from hemorrhagic disease. So the next question. A 22 years old married non-pregnant woman developed rubella infection. In order to avoid congenital rubella syndrome, in her pregnancy, she should be given antibiotics, advised to avoid conception for 12 weeks, and antiviral therapy, and none of this. So here, for that woman with that rubella infection, we need to advise to avoid the conception for 12 weeks of period. So next one, the dose of PCG vaccine until the age of 1 month is 0.1 ml intradermal on left upper arm, 1 ml intradermal on left upper arm, 0.5 ml intradermal on left upper arm, 0.05 ml intradermal on left arm. Here, the correct answer is 0.05 ml intradermal on the left upper arm can be administered up to the 1 month of period. So from the birth, if they are asking, so suppose if they are asked at the birth, we can go with the option A. That is 0.1 ml intradermal on the left upper arm. So next question, the posterior fontanelle usually closed by age, that is at 1 to 2 months. Suppose if they are asking anterior fontanelle, the option will go with that 1.5 year. The question number 32, measles and MMR vaccine is sensitive to heat and light, sensitive to heat but stable to light, relatively heat stable but sensitive to light, D, stable to heat and light. So the correct option is C, relatively heat stable but sensitive to light. So the 33, which of the following is the most logical sequence? So they are given that impairment, disease, disability and handicap, and they were misplaced in that different options. So but the correct answer is first will used to happen the disease, then go for the impairment and disability, and finally will the person reach handicap. So this is the correct sequence. And the next one, 34. Among the following, dash disease of the oral cavity carries serious risk of death. So among the children, that Ludwig angina is the serious cause for the oral cavity carrier for the serious risk of death. So the next one, the toll-free number dash has been assigned for that provision under the Maharashtra Emergency Medical Service is, they're asking that toll-free number, that is a 108 were assigned for the emergency medical service. So the next one, the population-based screening for that NCD is done among dash years and above age group, that is the 60, 50, 40 and 30. But the correct answer is above 30 years, the population-based screening can be done for the non-communicable disease. So the next one, from that psychiatric, that is a persistent irrational fear of an object is obsession, compulsion, phobia and delusion. So the correct answer is phobia. So next one, regarding the dementia. So what is the true about dementia? That is Alzheimer's disease is most common form of dementia, and dementia is one of the major cause of disability and dependency among the older people worldwide. Although dementia mainly affects older people, it is that normal part of aging. And the final one, all of this. So that above all three options were correct regarding the dementia. So the option D were correct. So the next one, direct question, that is 39. The IQ, intelligent quotient, is calculated by, so everyone knows that simple formula, that is the option A, mental age divided by chronological age into 100 is correct for calculating the IQ score. So next, 40th, which day is celebrated as International Day of Yoga? The June 21st is the date we were celebrating for the International Day of Yoga. So next one, recyclable plastic waste like IV tubes, catheters should be segregated in dash color bag, that is a black, white and red and yellow. So here that red color bag will be used for that waste management of IV tubes and catheters. So this is the one of the question even they asked in that AIMS on the NORCET 2020. So in that 42, the SARS virus belongs to which family of virus? That is that picornavirate and herpes virate. and coronaviridae and biniaviridae. So everyone on the pandemic, we knows that very clearly. That is the source is belongs to the coronaviridae. So the next question, 43. That is that in IDSP, that is the Integrated Disease Surveillance Program, when people comes to health center and information of collected, it is called as passive surveillance, active surveillance, sentinel surveillance, and opportunistic surveillance. So the correct option is passive surveillance. Suppose if that healthcare members were visiting the home visit and collecting the information, that will goes for the active surveillance. So next question. In National Program for the Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke, criteria for the diagnosis of diabetes 2 mellitus using the venous blood is option A, fasting glucose more than or equal to 100 mg per deciliter or post glucose more than or equal to 140 mg per deciliter. Similarly, they are given that 4 option. So according to that IPPCDCDS, so the correct option is we can go with that B, that is that fasting blood glucose more than or equal to 126 mg per deciliter or post glucose level more than or equal to 200 mg per deciliter is correct option for diagnosing the type 2 diabetes mellitus by using that venous blood pressure. You can take this reference. So this is the reference which is taken from that NPCDCES according to the WHO. So the next question. So in that NPCDCS criteria for the diagnosis of stage 1 hypertension is they given the different systolic and diastolic blood pressure. So from the table you can see for diagnosing that stage 1 hypertension for the systolic 140 to 159 and for the diastolic 90 to 99. So the correct option is A, systolic 140 to 159 and diastolic 90 to 99. So next question. For 30 to 65 age group females, pap smear test should be done every dash years. So the correct option is for the age of 30 to 65 years for identification of the cervical cancer, every 3 years the person can go for the pap smear test. So next one. The common criterion for the cataract surgery is complications, maturation of cataract, visual impairment, and all of the above. So the visual impairment is the most thing for the person can refer for the cataract surgery. So the next question. The cause of congenital deafness in children, hereditary, birth injury, rubeola, and all of the above. So here the hereditary, birth injury and rubeola, all three are correct for the congenital deafness. So the D is correct. So the next question. Dash is that suppurative infection in that lacrimal sac, sty, hordeola interimum and acute dacrycytis and all of the above. So here the acute dacrocytosis is the correct answer. And the last question. The concept of hospices is related to euthanasia for the terminally ill patient, family health advisory service, and association running orphanage for that abandoned children's, and D, special group of people helping the old and terminally ill patient. So here the correct answer. The main concept of providing the hospices care is the D, the special group for people helping the old and terminally ill patient. It may be any kind of disorders. So thank you for joining with me. I hope I may provided all the correct answers for all 50 questions. So if there is any corrections in the questions, you can write it in the comments box. And thanks for joining with me.